Hi, my name is Brianne Beard. I am a sickle cell disease social worker at Children's Hospital Los Angeles and part of CHLA's Pediatric Pulmonary and Sleep Medicine Leadership Program. I'm going to present some of my research protocol on the patient experience with patients that have cystic fibrosis and sickle cell disease. Let me go ahead and get started by sharing my screen. So the name of my project is called The Patient Experience, and just a little bit of background into why I decided on this project. I am a new social worker in the sickle cell department, and I've had a lot of families share with me their medical trauma and some of their experiences at CHLA and receiving care elsewhere. And for these families, their race played a large part in the care that they received and their medical trauma. So I wanted to give these families another platform to share their experiences and also learn from their experiences and see what CHLA could be doing better and what we all could be doing better to serve all of our patients. So this project was definitely a team effort. I was supported and have been supported by several different researchers. I've collaborated with multiple disease teams, our pain team, our sickle cell disease team, our cystic fibrosis team, our pulmonary doctors, as well as CHLA's diversity and equity inclusion officer. So it has very much been a team effort. So a little bit about cystic fibrosis. It's an inherited disease that threatens the lungs and the digestive system. Cystic fibrosis affects the cells that produce mucus, sweat, and juices. So those fluids become very sticky and they start constricting airways. Some of the symptoms can include cough, lung infections, inability to gain weight. A little bit about sickle cell. It's also an inherited disease where the blood cell becomes misshapen, as you can see, and those cells die. So there is less healthy blood cells a patient with sickle cell disease has, which often means that they may experience pain crisis, they can experience infections, and also fatigue as symptoms. A little bit of background on the two diseases. So they are both chronic diseases that are characterized by pain, frequent hospital encounters, and similar morbidity or mortality associations. That's really where the similarities end. They both have different research funding, different amounts of money going into their research funding. They both have different racial demographics. As a caveat, CHLA has one of the largest Hispanic cystic fibrosis population, and they both have different levels of political support, and patients have reported very different experiences when they are receiving medical care. A little bit more background. So there's been research done on adults with sickle cell, and they found that these adults have had significantly negative healthcare experiences and suboptimal medical care. These adults with sickle cell disease are also susceptible to explicit and implicit bias when they are seeking medical care. Researchers have also found that Hispanic people with cystic fibrosis, did not experience the same positive outcomes as non-Hispanic patients did. And a little rationale for why I am doing this project is because we all know that race, ethnicity, and socioeconomic status are predictors in differential healthcare and healthcare outcomes. And also, this isn't just with adults, but also in pediatrics. So the American Academy of Pediatrics considers racism a social determinant of health, stating that it has profound impact on the health of children, adolescents, emerging adults, and their families. One of the statistics that I did want to point out is by the year 2044, it's estimated that more than half of Americans will belong to a minority group, which just means that we all have to look at the way we're treating our patients and our families and make sure we are providing equitable healthcare to all of them. So my research questions for this project was, is there a difference in young adult patients with sickle cell disease and cystic fibrosis, self-reports of perceived racial discrimination amongst healthcare providers? And is there an association between perceived racial discrimination, health-related quality of life, and pain in the same population? So this research project will have a mixed method design where there will be validated questionnaires measuring the health-related quality of life, which is the Pediatric Quality of Life Inventory by J.W. Varney, pain interference, which is the PROMIS Pain Interference Scale, perceived racial discrimination, which will be measured by the Interpersonal Process of Care Survey, as well as the Everyday Discrimination Scale. And then there will be qualitative data, which would take the form of focus groups, where both the patients with cystic fibrosis and the patients with sickle cell will be able to really share their personal experiences receiving care for their diseases, as well as their caregivers. So there will be a few different focus groups that will dive into these topics a little bit deeper. Recruitment and eligibility. I would be using convenience sampling to find my participants. My participants would be 16 and up, and I would be recruiting in person, over the phone, via email, and caregivers of these patients would be invited to participate as well, and they would all be reimbursed for their time. I wanted to just leave you all with a couple graphics, just looking at some of the questions the patients will be asked. These questions are from the health-related quality of life measures. These questions are from the PROMIS Pain Interference Scale. And these questions are measuring racial discrimination, which is the Interpersonal Process of Care Survey by Haywood, and the Everyday Discrimination Scale by Williams. And also, here's a snippet of some of the questions that we will be asking our patients during their focus group. And again, the parents would have their focus group as well. So this is a quick breakdown of my work schedule and plan for the project. I'm waiting for IRB approval at this time. So once I get approval, I'll start recruiting and also collecting data, recruiting and consenting. So collecting the quantitative data as I go over the period of 2 months, and also conducting the focus groups over a period of 1 month, and conducting data analysis throughout the rest of the research project. I wanted to leave you all with my references, and that is it. Hopefully this project will be successful and it will give us further insight into what we are doing right and opportunities for improvement at CHLA. Thank you.